Healthwatch, and we're here at the Suffolk Show today. It's the gloomy Suffolk Show, listening to people's experiences of health and social care services, because we know if people actually feed back to us about their experiences, good or bad, or what they feel could improve them, we can make a difference.
Well, basically last time was Ipswich Hospital, and NHS one there, and we were just queued for hours, weren't we? We were there for from about 11 until 7 in the morning, and it took them six or 7 hours until we actually got seen by the doctor. But other than that, like, I've been in there a few times, broken leg and that, and they've been all right. It's just the queues, the wait.
My last experience of using NHS was when I was diagnosed with cancer. I had mouth cancer, and I went through the entire system, so right from diagnosis to actually 8 years later being free of the disease, touch wood. And I can't fault the treatment that I had. However, I feel that the aftercare you receive once you actually come out of the other side is very poor. In terms of what I experienced, I had facial disfigurement, but there was no psychological support available. And I feel that for people who have gone through a major illness, there needs to be far more support and signposting to actually put you in touch with the services that can actually help you to get on with the remaining, with the remaining part of your life.
Yes, well, I'm here at the Rural Coffee Caravan, and as you probably know, maybe not, we go around lots of villages throughout Suffolk, mostly the ones that are rurally isolated, very poor transport links, lost pub, shop. At our visits we often meet people who have a big issue with transport, getting to appointments, hospital. I know one lady at one of our visits had to go 80 miles round trip for a blood test. She was elderly, didn't drive. A lot of people in these rural areas don't know about Healthwatch, so we tell them what their options are to get their voice across. And to many people that think that finally they've got an outlet and people will listen to them and they feel included, as well as the towns and cities. And it's just great to be able to let them know what's going on and how Healthwatch operates.
I went to A&E because I fell down the stairs at school, and they were really good and really helpful. We were in and out of there really quickly.
Hi, I'm Ben Matthews from Community Action Suffolk. I'm a Marketing Communications Officer and work a lot with Healthwatch Suffolk, helping you guys promote consultations and surveys and anything which allows the community to have a voice and respond to particular needs and services. As Community Action Suffolk, we think that's really important. Anything that helps build and strengthen communities is really key.
Basically, I've been to the hospitals and my GP lately, and been getting very good treatment from one GP specifically, and again at the hospital, where I'm under multiple health professionals due to my disabilities.
Yeah, so my experience of mental health services or GP hasn't been that great. So this time last year I was in quite a dark place. I have a history of mental illness, so I knew I wasn't in a very good place. I needed some serious help, and really I felt like the GP that I was talking to maybe didn't understand the seriousness of the situation, and put me back on my antidepressants and wanted me to go away and come back and see him in a few weeks' time. But because I understand the system, I did ask if there was someone in the surgery that specialised in mental health that I could talk to. And at that point I was told that there was a mental health link worker, and would I like to see them. So I feel that maybe that should have been offered to me before I had to ask for it. And actually that GPs maybe need to be a little bit more clued up about mental health problems, and actually be looking for opportunities to signpost people and to move people on if they feel ill-equipped.
My last visit to the doctors was really good. The doctor was really helpful, he listened to me. He's a doctor that I hadn't seen before, so it was a nice surprise to actually have a doctor who was really helpful, gave good advice, and hopefully will get me the outcome that I want.
Yeah, someone who's had health issues themselves, I had a heart problem, and really appreciate the sort of work that Healthwatch Suffolk are doing, because the people like me need advice and so on. And I've also got involved in a charity myself, the Parish Nursing Project, where we refer people on and we get the information from Healthwatch Suffolk, which is really useful. We hand out literature whenever.
So health and care is obviously very important. It's a very important agenda for Suffolk and for the Health and Wellbeing Board as a whole. I work for public health, so it's really, really important that we listen to what people of Suffolk are saying, what they care about and what's important to them. And I think that's why working with Healthwatch is very important, because they represent and speak to the people of Suffolk about what matters to them. So public health, we have a role. We're concerned with the population as a whole, how healthy they are, how well they are, but we also have a key role to work with other partners, including Healthwatch, to find out what matters most to them.